So with several different approaches for hair restoration, we have both surgical and non-surgical. We're going to dive into both of those. Let's start with surgery. The traditional hair transplantation options included things like taking punches from parts of the hair, adding punches. That had more like a doll-like appearance after the procedure was done. This soon evolved into a strip method where you take a strip of hair from the back of the scalp and put it into small little pieces, identify the individual follicular units, and then individually transplant them back into the areas of hair thinning. That had a very natural look on top, but sometimes a visible scar behind the scalp. Another approach, which is one that we use here at Integrated Aesthetics, is follicular unit extraction using Neograft. And that's where we take out one follicle at a time. Sometimes there's 2 hair follicles right next to each other, and sometimes there's even 3 or 4. But these are units that we take out individually through very small little micro punches, and then we're transplanting them also one at a time. And that creates both a natural look on where you're adding the hair, but also a fairly invisible area where the hair was harvested from. Now you can refer to the back of the hair. I've done this a few times, and that's because this concept of donor dominance. Donor dominance typically means that the hair follicles retain the properties from where they come from. So the back of the scalp is usually resistant to things like genetic hair thinning or just thinning of the hair in general. So it becomes a resistant area where if we borrow those hairs, plant them into areas where it's traditional thinning, those hairs are going to still think they're behind in the back of the scalp and will continue to flourish in their new environment. So that is the surgical overview for the different options for a hair transplantation. So who's a good candidate for Neograft? So in general, it is a surgical procedure, albeit it's a very minimally invasive one. We still want you to be in good health. Ideally, you're not on any kind of blood thinners, you're not smoking, or any other medical conditions that might impair wound healing. Besides that, from a medical standpoint, if you're cleared, from a scalp standpoint, you want to be thinning a little bit in the hair, possibly a little bit more, and you have to have a rich donor site where we're able to borrow the hair and transplant that into the scalp. If you have extreme thinning, then we just have to manage the expectations in terms of how much density we can achieve. And once we have that discussion during the consultation, we can then determine whether to focus your transplantation more in the front, the middle, or the back, depending on where your concerns are. One of the main benefits of Neograft and follicular unit extraction and transplantation is that it's minimally invasive, recovery is very well tolerated, the results are extremely natural, can be done on pretty much all different hair types, curly hair, straight hair, etc. And it's very hard to tell that you've had anything done in terms of visible scarring because they heal pretty much without a scar. So this is where we're really moving into some of the non-surgical options. There are both pharmacologic medications that you can take to help stimulate hair growth. There's also injections that we can do, things like PRP, PRF. PRP, PRF stands for platelet-rich plasma or platelet-rich fibrin. That's where we're drawing blood out, spinning it down, injecting it into the scalp. This in turn provides a very nutrient-rich environment, which just allows those hair follicles to flourish, and it slows down that thinning process. It's done in an office visit. It's very short, and it can be repeated with some frequency, maybe 2, 3, 4 times a year, depending on the cadence that you want to set for your hair, and it's very well tolerated. We can also do some novel topical therapy where we're adding things like exosomes to the scalp, and that can also provide a nutrient-rich environment for your hairs to grow, and that really helps to slow down the hair thinning process. In conclusion, we have both surgical options and non-surgical options. Surgery, we described Neograft, which is minimally invasive, so you really can't even tell after you've healed that you've had surgery. Provides new hair follicles to the areas that we're thinning and we're borrowing from the back of the head, versus non-surgical, which is where we're drawing blood out, spinning it down, and injecting it into those areas. Also minimally invasive or non-invasive altogether besides the needle pokes. That too can help to restore some of the thinning hair that's occurring in the areas that we're targeting. Oftentimes we combine the two together because we're adding both new density and trying to firm up your existing hair follicles, and that combination can be fairly powerful at defending against the thinning hair. So there's a lot to hair restoration, both surgical and non-surgical options. If there are questions that we weren't able to address, please leave them in the comments. Don't forget to hit the subscribe and like icons, and we look forward to seeing you in the next video.